Okay, so it's a breathing, living organism as we continue to get updates and try and figure out what's happening in our world and our society, if it's our country, to our state, to our town. So if we look at where we were last week to where we are today, is our conversations, I feel like constantly are shifting, like people on the front lines and yourself trying to control what's happening. What are some noticeable, tangible differences that we see? Maybe if it's just numbers or if it's data that takes a little bit to be compiled. Where are we as far as the differences from last week to where we are today?
Well, I think that there have been a few changes, and this at the same time there is a consistency of some of the issues that we face. So, in terms of the pandemic itself and affecting the U.S., I think that everyone's reading the numbers off the news media, and we could see that clearly we are recruiting more infected individuals, as well as the number of fatalities is still on the rise, although I think that the rise may be this week somewhat contained in terms of the fact that we may be leveling off on the fatality. What you're also not seeing a lot from the news media is the number of patients who are being discharged after being admitted with COVID-19 infections. And that seems to also be somewhat increasing. So that's a sort of a silver lining, if you will. The other is that we're seeing more and more states or localities that have adopted social distancing, and that may again help in terms of addressing the spread of the disease. We still see that there are some hot spots. I think the one that is the latest one that we're concerned with, of course, is Detroit. And there are some reasons for why Detroit is, why Detroit and not some other cities in the Midwest, has to do with the trafficking of individuals who are potentially infected with COVID-19. On the other hand, the issues that we are contending with over the spread of this disease have been availability of equipment, which although I don't think that we have reached the point where we don't have any equipment, and the equipment may be supportive ventilators as well as personal protective equipment, is a major concern, but it is a struggle. And some institutions have more of that struggle than other institutions. So I think that overall, this is still a challenge. As you also know, the challenge there is in terms of getting available testing to centers, which is still a challenge. And one thing that we can't really assess is who has actually had a very minor exposure to the COVID-19, to the bug, and has developed immunity. So those tests are being developed, but we don't have that information, which would be very helpful in terms of letting people get back to a normal life and work. One of the other resource that we're starting to see being consumed without having sufficient replacement is the human element in providing healthcare, whether it be respiratory therapists, whether it be nurses, whether it be techs, whether it be other supportive healthcare providers, is now becoming evident that when they get ill or have to be quarantined, we're struggling to replace them. But as you hear from the news, media, which is real in a sense, is that other people are willing to step up and help. I just hope that the public remembers this once this pandemic is over, the commitment that healthcare providers and others have had, even though during quote unquote peace times or non-pandemic times, we take a significant beating, whether it be from our insurance companies and possibly also the government insurance. So I'm hoping again that this may change the approach of the public health to healthcare providers and those institutions that provide healthcare.
Can I just ask real quick? what was the protocol for H1N1, for Ebola, for other pandemic, for viruses that were spreading? And it didn't seem like, and maybe we have to go back, I don't know, 100 years to the flu, but what's the normal protocol? Because I would assume that while preparing, even if it's writing 4 or 5 years ahead of time and understanding the predictable surges in hospitals and the stress on healthcare professionals from doctors, nurses, and beyond, isn't there a built-in threat that anybody working on the front lines would then become sick and you would have to find ways to replace them? Or is that just something where, unfortunately, it was a bridge that was crossed at this point?
You know, the principles, again, when you have infectious disease, is the ultimate protection of the healthcare providers. And, you know, when we had Ebola come in, we spent enormous amount of resources at the time, financial resources, to provide, again, seclusion for those patients, as well as a very elaborate PPE protective, personal protective equipment for those who taken care of the Ebola patients. Because again, although the numbers were not high, the consequence of being exposed to Ebola was significant. The same with H1N1. The problem you're going to have is that you don't know what organ system is going to be the one that suffers the most under the circumstances. So for Ebola, it may be both respiratory as well as GI. For the H1N1, it was mostly respiratory, if you remember the SARS epidemic. So we're usually, you know, if you have to bet on it, it's probably going to be respiratory, but you may have encephalitis as the prevailing disease. So it's hard to prepare on that level in terms of a infectious disease point of view. And we cannot, in quiet times, it's very difficult for us to expand the skills of individuals because we're under licensure. So, you know, somebody from the laboratory can't essentially be trained as a nurse for the intensive care unit because of issues of licensure and education. So that is always going to be a challenge.
So I have a question, and before we get into some things that are being floated around on social media, and of course that's the big fuel, if you will, the catalyst for proper information, or unfortunately plenty of misinformation. There's something going on in my world, and I'm curious to get your thoughts on this. I'll just lay it out. Major League Baseball is the first sport that has come out, and they've even backed it down, saying they haven't even looked and drawn out any specific plan of it happening, but the big picture would be to put everybody, all 30 teams, the players, not families, but all 30 teams, the players, essential personnel, in a 22-mile radius in Phoenix, greater Phoenix, Arizona, where they have 15 fields from a professional down to a high school field, where they can seclude everybody for 4 months or so and play a baseball season. But it seems problematic because we're not talking about a desert island. We're talking about the greater Phoenix area, which is somewhere in the middle of, as far as cases are concerned, in the country. So I imagine that just on the surface, it's going to be very difficult, even if you continue to test people and players, because unless you're putting tanks up around a radius and making sure that nobody comes in and comes out, you're dealing with human behavior and improbabilities, which might be somebody who lives in that area going to a supermarket, coming back, dealing with a player, and then all of a sudden it just gets full blown and you're dealing with all hell breaking loose.
Well, there are two elements to this. On one hand, there is a significant desire to go back to normal life. And we can't minimize that because I think the consequences of recovery, both the economy as well as social aspects, is going to take time. And I think that clearly the damage is reversible, but the question is what's going to be the residual. So one of the aspects of normal life has been our involvement in sports, both as spectators as well as maybe even participating. I think that you can probably create some level of a barrier. As you say, is it foolproof? Well, it can be, because I think we've done a lot in terms of terrorism. So you possibly can create a situation where movement in and out of this, I guess, quarantine area is highly regulated. And, if you go out and you are suspected of exposure, you don't have to be even tested positive. You may not be able to gain access again. There are issues in terms of how you support the infrastructure of something like that, because they still need to eat. You still need to have, other cleaning services, et cetera, et cetera. I think that if the sport industry consults with the public health officials, and they can come up with a way of, again, protecting the players, but also the public at the same time, this could be a solution. Can we predict how that's going to, how that's going to fare? I think that the more we quarantine and the more we segregate those who are potentially infected or could carry the virus from those who we know are not infected and quote unquote clean from the virus, we could be successful in doing so.
But are you running a risk? And I don't want to lead, and I'm just asking, are you running a risk of restarting these leagues beyond the safety concerns that you laid out? Are you not running a risk of taking away top medical professionals, PPE as well, from the public in a situation that's not dire, that you are creating by taking doctors and other medical professionals away from hospitals and areas where they can treat the public, just to get baseball started a month or 90 days earlier?
So this is why I would recommend, again, working with public health officials. I could tell you right now that there are areas within the United States where there's a surplus of equipment and personnel, because the number of COVID patients is pretty low. And although we're predicting surge for every area, there may not be one in those situations. So the fluidity of the availability of both equipment as well as personnel may allow for this to be done in a quote unquote ethical or the right way. But again, I think that requires a lot of planning, and it requires also understanding that this is going to be something that's fluid. I don't think you're going to need a lot of personnel to do that. It's just a matter of addressing the possibility if things break down. And under those circumstances, I think that if it's planned right, you may be able to do that. Everyone is talking about the fact that we may not go back to anything that's going to be what we had in terms of normal. We're even talking about the Democratic convention and possibly even the Republican conventions as being virtual rather than having all these people come together. We have the technology to do that. And clearly, it may not be driven completely by a virus, but the way things are done today or were done yesterday may not come back completely. I don't think that this is going to be a major healthcare burden if it's done correctly.
Okay. So let's look at some things that I wanted to bring up on social media, because a lot of it is retweeted or reposted over and over and over again, and you never see the page 6 retract apology or clearing up of anything. The first is something that's been popular. Now, again, I don't know how popular of a theory this is, but it is coming from a PhD, former head of the department in Rockefeller. There is a belief, at least this guy's belief, and just curious to get your response on it, that, and I'll read you the quote, that the virus could be exterminated within weeks if people were allowed to lead normal lives and the vulnerable were sheltered until the virus passes. What people are trying to do is flatten the curve. I don't really know why, but what happens if you flatten the curve? You also prolong to widen it, and it takes more time. I don't see a good reason for a respiratory disease to stay in the population longer than necessary. And that's the end of the quote.
Well, this individual is not alone in making that claim. Is there right and is there wrong? I know that in Scandinavia there have been I think Sweden is one where life is exactly the way he's describing. Everybody is doing what they're doing. Um, in um, I know also in Israel there have been some theories that we should seclude the elderly and the frail and let the young just continue to party because again this is herd immunity. There may be a rationale behind this, but again there's also rationale in terms of social distancing. And both of these will have a toll on the population. And the question, of course, is which one. So both could be right, meaning that what we're doing right now in terms of seclusion and social distancing may may reduce the surge, although we haven't seen that happen in certain areas, and may prolong the exposure that we have to this virus. At the same time, it may actually do what we're expecting it to do, which is to get people through this with as many lives saved versus lost. On the other hand, what this individual is recommending is being tried by some countries, as I mentioned in Sweden and maybe even Norway, if I'm correct. But I know it's in the Scandinavian countries, and we'll see. Right now, they are doing okay. But the question, of course, is what will happen in the next few days and what will happen in the next few weeks.
Right.
If it turns out that they have very low mortality and infectivity, then the theory could be right. But we have to deal with what we've made the decision to follow at this point.
But how much of the issue that we deal with in controlling, mitigating, and ultimately returning back to normal is that we're nearly 400 million people spread across one of the biggest land masses on the entire globe?
All right, so I'm not really sure I understand the question. So.
Well, the question is, are we looking at a situation in Norway, for example, which is so much smaller than this country, and saying, well, it's easier from an actual geography standpoint, from looking at how wide or long a country is on a map, and saying it's easier in a smaller landmass than it is, let's say, in this country, where not only are we dealing with nearly 400 million people in a country that's so big, but I feel like we're one of the few gigantic land masses that deals with different states that have their different approaches, as opposed to a federal lockdown or even dystopian lockdown.
Well, that's a good point. The large countries like ours versus smaller countries in Scandinavia. But the way we do this in terms of trying to understand the impact of the disease independent of the geography and the population number is by doing a numerator denominator. And you look at your population as the denominator, you look at the number of potential infected as another denominator, and then the ones who are the ones who perish as your numerator. And it gives you an idea of how wide the disease is in terms of spreading and its effect, regardless of the mass. Right. So, if it turns out that they have similar statistical, the statistics in terms of numerator denominator are similar percentage of patients who are dying from the disease per the population that gets is potentially infected. I think that will help us understand their policy, which is what this individual is bringing up compared to the policy that we have.
So, final minute, let's look at specifically, if you can kind of tell people, give people any advice. The mask conversation changes by the minute. 3 months ago, we're told don't buy them. Now we're told buy them, wear them. It's like eggs, right? Every year it changes. What's good, what's bad. Where am I walking my dog in my neighborhood and keeping 15 feet away from people? Should I have a mask? Should I have a mask if I'm going to Target? Should I have a mask if I'm driving around, getting gas? Where should somebody really be wearing and using the mask?
Well, the recommendations for masks, keep in mind that those recommendations are not for N95 3M masks, which should be reserved for the healthcare providers. We are facing some shortages in some locations, and I think that once these shortages are behind us, that may be something that the rest of the population may benefit from. Clearly, if you're positive, you should be wearing a mask no matter what. However, as your examples of in terms of going outside, the mask that we're seeing that for the general population, the big question, of course, is are they better than nothing? And I don't know that we have an answer at this point. I know that the recommendations from federal government through CDC is that we now consider to wear masks when we're outside. Again, is it better than nothing? Psychologically, probably. Whether it's a piece of cloth around your mouth, most likely will have virtually no effect. Some of the masks may have some effect in terms of reducing exposure, but the best activity in terms of reducing exposure is staying away from an individual who's potentially infected, which, by the way, everyone's walking out there could be. So again, the social distancing is one which I think is much more effective. But I can't really sit here and say don't use a mask. At the same time, I don't say that you should be using a mask no matter what you do. I think it's a choice. If it's available, use it. It may help, but I don't think that's definitive.